Welcome to the Victory Education Lounge. I'm your host, and today we're tackling a topic that affects millions: musculoskeletal issues, joint and muscle pain. This is part 92 of our ongoing series on metabolic health. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Many people don't realize the significant connection between metabolic health, particularly insulin resistance, and musculoskeletal issues. Whether you're dealing with chronic pain, want to prevent future problems, or simply aim to optimize your overall health, understanding this link is crucial. Today we'll explore how insulin resistance affects our joints and muscles and discuss solutions, management strategies, and prevention methods. Have you ever wondered why you're experiencing joint and muscle pain? Well, you're not alone. Millions around the globe grapple with what we call musculoskeletal issues. These issues, encompassing a broad spectrum of conditions, are more common than you might think. And the surprising part, they're closely connected to our metabolic health. Specifically, insulin resistance, a condition where your body's cells don't respond effectively to insulin, can have a profound impact on your musculoskeletal system. This video is dedicated to exploring this very connection. We'll delve into how insulin resistance can affect your joints and muscles, leading to chronic pain and discomfort. We'll also discuss the potential solutions, management strategies, and prevention methods to help you navigate these issues. This is a journey of understanding, of connecting the dots between what might seem like unrelated aspects of your health. So, let's delve deeper into how insulin resistance can impact joint and muscle health. Firstly, insulin resistance can lead to chronic low-grade inflammation, contributing to joint and muscle pain. But what exactly is insulin resistance? It's a condition where the cells in your body don't respond effectively to insulin, a hormone that helps regulate blood sugar levels. When insulin resistance occurs, blood sugar levels can become too high, which can lead to a host of health issues, including chronic inflammation. This inflammation is a key player in many musculoskeletal issues. It's like an unwelcome house guest that overstays its welcome, causing discomfort and distress. Chronic inflammation can lead to painful conditions like arthritis and tendinitis, and can also contribute to muscle pain and stiffness. So, what can you do about it? One effective management strategy is adopting an anti-inflammatory diet. This involves eating foods that are known to reduce inflammation, such as fruits, vegetables, and whole grains, and avoiding foods that can trigger inflammation, like processed foods and sugary drinks. Regular exercise is another essential tool in your arsenal against inflammation. It helps to improve insulin sensitivity, reduce inflammation, and strengthen your joints and muscles. Whether it's a brisk walk around the block, a yoga class, or a game of tennis, the important thing is to keep moving. Lastly, don't underestimate the power of stress reduction techniques. Chronic stress can exacerbate inflammation and pain, so finding ways to manage stress, such as meditation, deep breathing exercises, or even just taking time out for yourself each day, can make a big difference. But remember, everyone's body is unique, and what works for one person may not work for another. It's always a good idea to consult with a healthcare provider before starting any new diet or exercise regimen. Adopting these strategies can significantly reduce pain and improve overall health. So, don't let insulin resistance and inflammation keep you from living your best life. By taking proactive steps to manage these issues, you can enjoy better health and well-being. Secondly, insulin resistance is associated with an increased risk of osteoarthritis. Osteoarthritis, often referred to as wear and tear arthritis, is a condition that breaks down the cartilage in your joints, causing stiffness and pain. Now you may be wondering, what does insulin resistance have to do with a joint disease like osteoarthritis? Well, studies show that insulin resistance can lead to inflammation and oxidative stress in the body. This in turn can accelerate the breakdown of joint cartilage, thereby increasing the risk of osteoarthritis. This is particularly true for weight-bearing joints such as the knees and hips. So, what can we do about it? The first step is weight management. Excess weight puts additional strain on our joints, exacerbating the effects of osteoarthritis. Therefore, maintaining a healthy weight or losing weight if you're overweight can significantly reduce the pressure on your joints. Next, consider incorporating low-impact exercises into your routine. Activities like swimming, cycling, or yoga can improve joint mobility and decrease pain without putting too much stress on the joints. Remember, it's not about pushing yourself to the limit, but about finding a balance and listening to your body. Lastly, don't underestimate the power of nutrition in managing osteoarthritis. Certain nutrients like glucosamine and chondroitin are known to support joint health. They can help to slow the progression of joint damage and reduce pain associated with osteoarthritis. In essence, managing insulin resistance to prevent or slow down the progression of osteoarthritis involves a holistic approach. It's about making sustainable lifestyle changes that not only improve your joint health, but also enhance your overall well-being. Remember, everyone's journey is unique, and what works for one person may not work for another. Always consult with your healthcare provider before starting any new diet or exercise program. With commitment to these lifestyle changes, osteoarthritis progression can be slowed and quality of life improved. Thirdly, insulin resistance can lead to decreased muscle mass and strength, a condition known as sarcopenia. Now, sarcopenia isn't just a fancy term for muscle loss. It's a serious condition that's associated with an increased risk of physical disability, poor quality of life, and even premature death. The relationship between sarcopenia and insulin resistance is a two-way street. On one hand, insulin resistance can lead to muscle wasting, as insulin is a key hormone that regulates muscle growth. On the other hand, sarcopenia can exacerbate insulin resistance, since less muscle mass means less glucose uptake, leading to higher blood sugar levels. But here's the silver lining. Sarcopenia is not an inevitable part of aging. It can be prevented, managed, and even reversed with the right strategies. So, what can we do about it? The first solution is resistance training. Lifting weights, doing bodyweight exercises, or using resistance bands can all help stimulate muscle growth. And you don't need to be a bodybuilder to reap the benefits. Even moderate resistance training can make a significant difference. Next, we need to ensure we're getting enough protein in our diet. Protein is the building block of muscles, and research has shown that a higher protein intake can help counteract muscle loss in older adults. So don't skimp on your lean meats, dairy, legumes, or plant-based protein sources. Lastly, we need to keep our blood sugar levels in check. Remember, insulin resistance is a key player in sarcopenia. So, managing your blood sugar through a balanced diet and regular exercise can help maintain your muscle mass and strength. To sum up, sarcopenia and insulin resistance are intimately linked. But with resistance training, adequate protein intake, and blood sugar control, we can fight back against muscle loss. Improving muscle mass and strength can enhance overall functional capacity and metabolic health. Fourthly, insulin resistance can affect tendon structure and healing, leading to conditions such as tendinopathy. Tendons, the tough bands of fibrous tissue that connect muscle to bone, rely on a healthy metabolism for proper function and repair. When insulin resistance comes into play, it can lead to altered tendon structure, reduced healing capacity, and increased risk of tendon injuries. Insulin resistance can disrupt the normal healing process of tendons. In a healthy individual, the healing process includes inflammation, proliferation, and remodeling. However, in someone with insulin resistance, this process can be disrupted, leading to prolonged inflammation and inadequate healing. This can manifest as tendinopathy, a condition characterized by pain, swelling, and impaired function. Conditions such as tennis elbow, Achilles tendonitis, and rotator cuff injuries are all examples of tendinopathies that can be exacerbated by insulin resistance. But all is not lost. There are management strategies that can help improve tendon health and reduce the risk of injury. One such strategy is targeted exercises. Regularly performing exercises that strengthen the muscles and tendons can help improve function and reduce the risk of injury. This includes both resistance training and flexibility exercises. Proper nutrition for tendon health is another key strategy. This includes consuming a balanced diet rich in protein, which is essential for tissue repair, along with vitamins and minerals that support tendon health, like vitamin C, manganese, and zinc. Lastly, addressing underlying metabolic issues is crucial. This involves managing insulin resistance through lifestyle changes like diet and exercise, as well as potentially using medications under the guidance of a healthcare provider. The benefits of addressing these issues are twofold. Not only can it help prevent chronic tendon problems, but it can also improve overall health. For instance, Mike, a 38-year-old tennis player, struggled with chronic tennis elbow. By improving his insulin sensitivity through diet and adding specific tendon-strengthening exercises, he saw a 70% improvement in symptoms within 2 months. Addressing these issues can prevent chronic tendon problems and improve your overall health. Understanding the link between insulin resistance and musculoskeletal issues is crucial for managing and preventing these conditions. As we've seen, insulin resistance can contribute to a range of musculoskeletal problems, from chronic inflammation and pain to osteoarthritis, loss of muscle mass and strength, tendon issues, and even conditions like fibromyalgia. Yet, there's hope. By addressing insulin resistance, we can manage these conditions and in many cases prevent them entirely. Strategies like adopting an anti-inflammatory diet, regular exercise, stress reduction techniques, weight management, and targeted nutrition can all play a role. And remember, these changes aren't just about reducing pain or improving joint health, they're about enhancing your overall well-being. Because when your metabolic health improves, so does your quality of life. So, let's make a commitment to understanding and addressing insulin resistance. Let's choose to take control of our health one step at a time. Remember, taking care of your metabolic health can have a profound impact on your joint and muscle health. Musculoskeletal health is intricately connected to our overall metabolic health. By addressing insulin resistance, you're not just potentially reducing pain and improving mobility, you're enhancing your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better musculoskeletal health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to pain management and exercise, should be discussed with a licensed physician or qualified healthcare professional.